The Food and Drug Administration, friend or foe? The Food and Drug Administration, it sounds like a boring government agency, you know, the kind that makes sure your breakfast cereal doesn't contain actual metal shavings. And yeah, that's part of their job, but the FDA's reach goes way beyond breakfast. They decide what drugs you can take, what medical devices are safe, and even what you're allowed to know about your own health. Sounds important, right? It is. But here's the thing, the FDA is supposed to protect public health. Yet, we're sicker and more reliant on medication than ever before. So, are they doing their job? Or are they, as some argue, more interested in protecting corporate profits than the American people? That's what we're going to look at tonight. We're going to dive deep into the FDA, its approval processes, and its cozy relationship with the very industries it's supposed to regulate. Buckle up, folks, because this is going to be a bumpy ride. Because when it comes to your health, it's time to ask ourselves, is the FDA part of the solution, or is it part of the problem? Let's talk about food, specifically, the kind of food that comes in a box and has a shelf life longer than your average houseplant. Processed food. We all know it's not exactly health food, but it's cheap, it's convenient, and let's be honest, sometimes it's just plain delicious. But here's the thing. Much of what's allowed in our food in the US is banned in other countries. Artificial colors, flavors, preservatives, you name it, we've got it. And guess who gives these things the thumbs up? You got it, the FDA. Now, the FDA claims these additives are safe in small doses, but the problem is we're consuming them in everything. It's a chemical cocktail, and we're all unwitting guinea pigs in a giant experiment. And guess what? The results are in. Obesity, diabetes, heart disease, these are all linked to the consumption of processed foods, the very foods the FDA allows on our shelves. Coincidence? You decide. Now let's talk about Big Pharma, you know, those benevolent companies that bring us life-saving medications. Well, that's one side of the story. The other side, they're also multinational corporations with one goal: profit. And when it comes to making money, influencing the FDA is just the cost of doing business. See, the FDA relies heavily on fees from pharmaceutical companies to fund its drug approval process. This creates a clear conflict of interest. The FDA is essentially funded by the very companies it's supposed to regulate. It's like letting the fox guard the hen house, except the hens are our health and the fox has a team of high-powered lobbyists. And guess what? It gets worse. Remember the opioid crisis? Millions addicted, countless lives lost. It was a public health emergency of staggering proportions. And the FDA? They played a starring role. See, pharmaceutical companies pushed these highly addictive painkillers, claiming they were safe and effective. And the FDA, they bought it. They approved these drugs despite the lack of long-term safety data. They even allowed misleading marketing that downplayed the risks of addiction. The result? A generation hooked on opioids. It was a disaster, fueled by corporate greed and enabled by regulatory failure. And it's not an isolated incident. Time and time again, the FDA has approved drugs that later turned out to be harmful, sometimes even deadly. It begs the question, who is the FDA really working for? The American people, or the corporations lining their pockets? Section 5. Treating symptoms, not curing diseases, the profit motive in modern medicine. Here's a thought. What if instead of curing diseases, we just treated the symptoms forever? Sounds like a terrible idea, right? Well, to Big Pharma, it's a business model. Think about it. A cure means one-time profit. Treating symptoms? That's a recurring revenue stream. And who benefits from this focus on symptom management? That's right, the pharmaceutical companies. And who loses? Patients who are often stuck on expensive medications for years, sometimes for life. Now, I'm not saying all drugs are bad. Many medications are essential for managing serious conditions, but there's a difference between managing symptoms and actually addressing the root cause of a disease. And too often the focus is on the former, not the latter. It's time to start asking hard questions about why we're so focused on treating symptoms instead of finding cures. And we need to demand more from the FDA, an agency that should be prioritizing our health, not Big Pharma's bottom line. Section 6. The revolving door. From FDA to Big Pharma and back again. Ever heard of the revolving door? No, it's not a new dance craze. It's the cozy relationship between the FDA and the pharmaceutical industry. See, it's not uncommon for FDA officials to leave the agency and take high-paying jobs at the very companies they used to regulate, and vice versa. This creates a clear conflict of interest. It's hard to imagine that someone who's hoping to land a lucrative job at a pharmaceutical company is going to be tough on that company while working at the FDA. It's like expecting a referee who's also on the payroll of one of the teams to make impartial calls. This revolving door undermines public trust in the FDA. It creates the perception, and perhaps the reality, that the agency is more interested in serving the interests of Big Pharma than the American people. It's time to close this revolving door and ensure that the FDA is working for the people it's supposed to protect, not the industries it's supposed to regulate. Section 7. The high cost of medications, a symptom of a broken system. Let's talk about the elephant in the room, the sky-high cost of medications in the United States. It's no secret that Americans pay more for prescription drugs than people in any other developed country. And the FDA plays a role in this. See, the FDA's drug approval process is incredibly expensive and time-consuming. This creates a barrier to entry for smaller companies and generic drug manufacturers, limiting competition and keeping prices high. Add to that the fact that the US government doesn't negotiate drug prices like other countries do, and you've got a recipe for pharmaceutical price gouging. The result? Millions of Americans struggle to afford the medications they need. They're forced to choose between their health and their financial well-being. This is unacceptable. The FDA needs to streamline its approval process, promote competition in the pharmaceutical industry, and work to lower the cost of medications for all Americans. Section 8. Transparency and accountability, shining a light on the FDA's practices. The FDA makes decisions that impact the lives of every American. Yet its inner workings are often shrouded in secrecy. This lack of transparency breeds distrust and makes it difficult to hold the agency accountable for its actions. We need more transparency in the FDA's approval processes. We need to know how decisions are made, what data is being considered, and what influence outside groups have on the agency. This information should be readily available to the public, not hidden away in bureaucratic black boxes. Sunlight, as they say, is the best disinfectant. By shining a light on the FDA's practices, we can help ensure that the agency is working in the best interests of the public. Section 9. Legislative reforms, putting public health before corporate profits. The FDA needs more than just a little transparency makeover. It needs a systemic overhaul. We need legislative reforms that prioritize public health over corporate profits. This means reforming the FDA's funding model to eliminate conflicts of interest. It means closing the revolving door between the agency and the industries it regulates. It means empowering the FDA to negotiate drug prices and make medications more affordable. These reforms won't be easy. Big Pharma has deep pockets and powerful lobbyists, but the health of the American people is at stake. It's time for our elected officials to stand up to corporate interests and put the needs of their constituents first. Section 10. Taking back our health, the power of consumer choice and advocacy. The FDA may be a powerful agency, but it's not all powerful. We, the consumers, have a voice. We can make choices that impact our health and hold the FDA accountable for its actions. We can choose to eat real whole foods and avoid processed junk. We can educate ourselves about the medications we're prescribed and demand transparency from our healthcare providers. We can support organizations that are fighting for FDA reform and a healthcare system that puts people before profits. Our health is in our hands. By making informed choices and raising our voices, we can create a healthier future for ourselves and generations to come. Section 11. The future of the FDA, a call for ethical and effective regulation. The FDA has a critical role to play in protecting public health. But for too long, the agency has been plagued by conflicts of interest, a lack of transparency, and a cozy relationship with the very industries it's supposed to regulate. It's time for a new era at the FDA. An era of ethical and effective regulation that puts the needs of the American people first. An era where corporate profits no longer trump public health. This is a call to action. A call for transparency, accountability, and reform. A call for an FDA that we can trust to safeguard our health and well-being. The future of our health depends on it.